Product development is a process. So for people who are creatives, when you hear the word process, my wife is in that bucket. There is a grimace, but the reason it is a process is industry wants it to be repeatable, right? You can't just have a one-off. That's not good enough. How do you make each and every product successful, and how do you do it faster? So it is a process, and being a process, there is an end in mind, right? A destination, and of course there is timelines, budgets associated with that. So the first part is destination, which is how do you ensure that your product is going to be successful, right? If you just have an idea, that's great, but now there is quite a leap from getting an idea into a commercial product. Okay, so that's what we're going to talk about here. So how do we define success, right? What do we mean by a product is successful? So this early work was actually done by three sort of academicians at the University of Iowa. So they looked at, when I think it was Monsanto, but when hybrid seeds first got into the market, they were looking at how farmers were adopting the use of these hybrid seeds. And Rogers, one of the three, has written a book called Diffusion of Innovation. Okay, so this bell curve essentially represents like all possible customers who may buy your product. Okay, so if you're looking at hybrid seeds, it's going to be all the farmers. If you are looking at doing something like orthopedics or something, it'll be all the patients, if you will. So bell curve represents everybody. Okay, and what they have seen is that initially up to, I guess, 16% of it, right? You'll have people who buy it are called innovators and early adopters of some technology. Okay, and this piece is roughly around 16%. I mean, obviously not exact, but somewhere around there. But for your product to be successful, what you need to go is from these early users to the mass market. Okay, and then what you see is that at the tail end of this mass market, again, somewhere around 16% is what I call laggards. People who just will not adopt. You could almost argue that you see some people still having flip phone, right? That is, today we are in the day of smartphones, right? So if you're in this flip phone user, in the phone example, you would be in the laggard. So you're now never going to convert 100% of your customer base. But this middle 68 is where the money is made. Okay? So the key is this one. How do you transition from the beginning to mass market? Okay? You don't want your product to only be a novelty. And there are countless examples. If you hear this phrase called crossing the chasm, that means it has transitioned from here to here. Today, some technologies that are sort of still in this novelty is, if you look at electric cars, right? Tesla, so many companies selling electric cars, but electric cars still represent about 2% of the cars sold in the US. It is still promising, and we think it's going to obviously catch on, right? Smart homes, right? All the technology that goes into smart homes, like, right, I can get on my cell phone here and turn on the oven at home or lights and things like that. That is still stuck here. It hasn't made the leap into the mass market. Your product being successful means that it has transitioned into mass market. So how do you, as an entrepreneur, sort of make decisions to ensure that your product is going to go there? The Product Development Association sort of did a study, and some of the statistics out of that is, if you look at consumer goods, essentially products are like a coin toss, right? Half of them fail. If you're looking even at medical device, 1/3 of them are failing. Okay, so can we improve these odds? Okay, and a key consideration to doing that is if you look at your target customers, right? The first thing that you need to do is to identify a need that is not addressed today. Many times we sort of feel that we have an idea, or this would make a fantastic product. That's great, but if you're now going and trying to get money from venture capital or others to fund your product, the first thing they will want to know is who are the users and how many there are. Because that is only going to determine the valuation, right? It's not good enough to suddenly say, you know what, hey, coffee maker, if I put Bluetooth on that, that's a fantastic thing. Nobody has a Bluetooth and coffee maker together. I mean, people are just coming out with it, but there are not a lot of those things. It may be a great idea, but before somebody seriously puts money into it, how many people, I mean, what need is it really serving, right? And how many people would be really interested in buying Bluetooth coffee makers? You have to answer that question. So first thing when you're trying to do product development is to find that there is a need that is not well addressed in the marketplace. You have to start with the market and then come up with the idea. You cannot start with a product first approach. Product first approach is typically not successful. If you look at electric cars, right? If you think of electric cars, what's the first company that comes to your mind? Electric car companies. Tesla, right? And are there other people who make electric cars? But Nissan Leaf does, right? BMW does. Chevy Volt is just coming out with one, right? But what is the big difference between, let's say, a Nissan Leaf, which is probably the second most popular electric car, and the Tesla that is out there? The big differentiator is that the Nissan Leaf only does 70 miles per charge. Okay, 70 miles claimed, but when you go in winter, you get a knockdown factor of maybe probably a 50 miles per charge. Now, how many people in this area are willing, I mean, commutes are probably longer than 50 miles per hour. How many people are now willing to buy a Nissan Leaf, right? It's not meeting the customer need, right? That you could argue is a little bit of product first thinking. We're going to make electric car. The cost of this electric car should be somewhere around $25,000, right? Government gives you rebate. So if I make a car within $32,000 with rebate, I hit the price point. That's great. But now you have constrained a feature that is very critical for customers. You have what is called range anxiety, right? To make an electric car successful, you have to go to the extent that Tesla is. Like with the Model 3, right? That is also going to be around 35,000, but it has a range of, when he announced it, right, Elon Musk, it has a range of 200 plus miles. But to get to that, he is building, I mean, aside from the car company, he's building a battery company in Nevada, which is essentially doubling the lithium battery capacity of the entire world. That is what it takes to make an electric car which meets customer need. So you get the idea that you cannot just have a product and sort of put it out there, because if you don't understand what the user needs are and address that, product not going to be very successful. The second generation of these electric cars, like Anu said, the Chevy Volt, right? That is going to be a 200 miles per charge type car. Okay? So how do we understand these user needs? We'll do an exercise a little later on that. So step one is to understand the user needs, and then is to come up with a product idea or definition that will meet that need. If your piece doesn't fit the user need, not going to be very successful again. Okay? All right. And in terms of asking customers or going to the marketplace and saying, oh, what do you need, right? They are not really good sources of expressing their need. And this is a very famous quote by Ford where, you know, when he's way back, I think 1900s or something, he sort of said, yeah, if you ask people, if he asked his customers what they wanted, they cannot visualize a car, right? They would have just said faster horses. So just going and asking customers what do you need is not the best approach or best way you're going to get that information. What you really have to do is to get a deep understanding of the use environment. This is going back to like Jane Goodall, etc., who really lived amongst the chimpanzees and sort of understood what the behavior was. Okay? You cannot sort of stand outside and observe customers. Okay? And in this technique, there is this phrase called, you really have to swim with the fishes, right? Immerse yourself in that use environment to understand what features or what troubles people are having, and then come back and design your product. Okay? Example on this case, right? Well, what does this, I mean, sort of, you know, you have elderly parents, etc., right? I mean, they might be on different medication, and you see there are a lot of innovation on this kind of product line. There are pill boxes with alarm settings. You can also have pill boxes with, you know, for the whole month, like 4 of these things, right? What are they trying to solve? I know of people who will once a month go for, you know, drive 2 hours and take all the pills and arrange it for their elderly parents, right? I'm not sure anybody here is having to do that, but you can visualize, and maybe your parents are not yet old enough for this kind of a solution, but a lot of you know, people doing in this one. But if you now immerse yourself into that problem and truly understand that, right? I guess a local company, very innovative. We'll see how, they're not public yet, but there is a company called PillPack. Some of you have heard of this, right? But what they do is take your prescription and put it into individual packets. So instead of getting a bottle of, you know, bottle of medicine A, bottle of medicine 2, medicine 3, and you having to do that, they will ship to you this thing with the pills and the time. You have to take it on this day at 8 a.m. These are the 3 things to take. At 12, these are the 2 things to take. It's got a lot of investment, but again, this idea comes about by sort of experiencing or getting an understanding of what the user need is. Okay? The question now always becomes, how many should we talk to, right? The default assumption always is more the better, right? Anything with data, right, is always, oh, large sample sizes. But actually, people have done some work, and this is the reference down here. But they have done some modeling which basically says you can get 80% of the user needs, talking to about 16 odd customers. Beyond that, you're going to hear a lot of repeats, if you will, right? So 16 is not a very large number. It's definitely easy to handle that. And when we have done studies like this, usually these involve like an hour-long conversation with the, I guess, targeted customers, if you will. And an hour-long conversation, if you record it, there are sort of resources in Philippines, India, who will now transcribe that to you for actually very little money. Sometimes it varies, like 5 to 10 cents per word, depending on the field. And so it'll come out to like 17, 22 pages of text, that transcript that you have to review. And I'm just giving you that information because that's what we'll be doing next. Okay? So once you, let's say, have talked to customers, right? And the reason to get transcripts is you may, you'll have a team of people, and or even if you have talked to all 16 of them, right? Now when you want to share that, what you learned with others, right? It's easier to have them read rather than just listen to the recordings, if you will. Okay? And this technique that we are going to discuss next is something invented by a Japanese anthropologist in the 1950s called Iro Kawatika. The technique is called KJ image, and once it was sort of taught here by the Center of quality. And it's essentially called natural language processing. But the way the technique works is the following, right? The first is you got to define what is the problem area or the user base that you're going to work on. That is called the theme of the project, if you will. Okay? Next, you go and talk to customers. Okay? And then when you talk to customers, you're going to get a lot of pages and pages of transcripts, if you will. The second step is to have a cross-functional team, and typically we're talking team sizes like 5 to 8. Okay? And the key to that is not to have all people of the same function, like not all marketing people or not all engineering people, because you're, the view that you're going to have when you read the transcripts is all going to be the same, right? If you have all mechanical engineers, they will always look at what are the problems and solutions, if you will. So you need a cross-functional team to read through the transcripts, and what you do there is basically extract, like as you're reading, you sort of extract some phrases that the customer said, and that becomes, I mean, when you read that, an image crops to mind. For example, when we did this for vacuum cleaners, one of the things was this woman said, oh, this, usually I have to ask my husband to put stuff together. But on this one, this particular vacuum cleaner, it was so easy to assemble, I could do it myself, right? So when you read that, I mean, as a person reviewing it, I'm like, oh, the ease of, that was something she was thrilled with, that she didn't have to get external help and could do it herself, right? So when you read the transcripts, this is what we mean by images. So you're capturing the original sort of words that the customer used, and you're trying to now get what is the essence behind that. Okay? So when you do one of these exercises, you will probably have like 200 to 400 images. And all these images are sort of stuck in the world, but on the wall, but 200, 400 is like too many to work with. Okay? So then what step 3, your cross-functional team does is they actually put dots on them and select what is more important. So 2 dots means we had to go through 2 rounds of voting, but ultimately you want there to be something like 20, 25 images. So out of all the 400 images that your team collected, you're trying to now reduce it to something like 20, 25, which becomes more manageable. Okay? Obviously, these images that the team has voted on are the more important ones. There's no point having duplicates of the same thing being told many times. Okay? Step 4 is now to take these images and sort of group them around theme, like things that are similar. On a phone, there might be a frustration expressed about, my phone doesn't last all day long. Okay? Or the other customer might have said something like, I have trouble finding places to charge my phone. But both of these things are essentially talking about, let's say, battery life of the phone. So you would group similar images, and the title would be that insufficient battery life. So that is the 4th step, where we are grouping these images to form similar sort of ideas, if you will. Okay? And the last step is, are there any relationship between them? For example, it could be that the logic or the, let's say, the cellular chip that you're using is communicating with the cell towers a lot, and it's using up your battery life. Okay? And that would be the last step in sort of trying to find the relationship between these groups, and then ultimately you will get a idea of what is the use environment that you're working in. Not only that, and one of these would be, if you see one where the images are a lot of complaints, that is probably an area where you would want to do improve your product, right? B, market leading. in your innovation. That leads to more success. Okay? Now, to make your product successful, it's not just to come up with that one thing, right? So you need actually three things. Okay? One is you need to have this, I guess in software world it's called the killer app, like one knockout feature that nobody else does today. Okay? But if you just have that, that is not enough. You also have to have what are called must-be features and preferred features, and we'll talk about these two in the next few minutes. Okay? So we looked at that bell-shaped curve, right? If you now do it cumulatively, it looks like an S-curve. And if you look at customer adoption over time, this is what happens. And this curve essentially has two things. Because of its shape, it's called the S-curve. Okay? And two things that all products do is that the value increases over time. And as the value increases, the customer adoption increases. And what I mean by value is if you look at from iPhone 1 to iPhone 7, right? The price is roughly the same, okay? But it does more today. The camera is better, the memory is more, right? So for the same money, it is becoming more and more valuable. And as it becomes valuable, it drives adoption. Okay? That is just the characteristic of products. This S-shaped curve has sort of 4 distinct regions. One is this early stage 1. This is where you got a product and people who are innovators, roughly 2.5% of the population, they will buy it. These are the people who stand in line when the iPhone gets announced. Okay? Then you have what are called the early adopters. So this is that first 16%. In this stage of it, right, the early adopters are actually pretty forgiving as far as to the drawbacks of your product. They really want your product to be successful. So if this is where, let us say you're working on a product which is, there are no good solutions, right? Everybody is trying to work on, let's say, what is this? Self-driving cars. There is no clear winner, right? And that is somewhere over here. If you're in a stage 1 situation, what you essentially have to do, your innovation strategy is to optimize the feature. That main parameter of value, that killer app, is not perfected to be in the mass market. Okay? If you want to go from that initial novelty to mass market, you need to perfect that killer app feature. So if you're in stage 1, your innovation strategy should be optimizing that feature. Okay? You have optimized the feature and you're lucky, and now you're moving into the mass market. The early part of that mass market is called early majority and late majority. Okay? Over here, what you have to do is to increase the value, that is, add more features. As you add features and increase the value of your product, more and more people will start buying it because it becomes more and more useful to them. Okay? So the innovation strategy over here, this is optimizing the features, and here it is adding more features. And by adding more features, what I mean is you're adding more of these preferred features. Okay? Customers don't buy your product only for that one thing. Right? Initially, people bought Tesla because it was all electric. One killer app, you got that, you're in stage 1. But now, over time, you know, Tesla has ludicrous mode, they have autopilot, they're adding features. And as they add features and increase value by bringing down cost, you're getting into mass market. So adding features is what you do in stage 2. Once you get into stage 3, you're sort of flat, you've gotten most of the thing. This is where you could argue, I mean, Apple has had a great 10-year run, but almost everybody in the US who is going to buy Apple has bought Apple, right? There's not that many new customers for them. They are somewhere over here. But if you're really in stage 3, that is where you're doing a lot of value engineering, bringing the price down. If you are not doing that, I mean, in time, sometimes your patents, etc., have expired, right? You'll have somebody who will offer that at much lower price. Okay? So in stage 3, what your approach should be is value engineering. So you somewhat have to gauge the product vision that you have. Where am I on this curve? Because the strategy you use is going to be different. And then it actually does decline. The value goes down. And the reason it goes down is because this is where you have, what was it? Francisco, right? You had asked a question about, do I do incremental innovation or out of the box something different? This is what this blue curve is essentially the same technology platform. Okay? This is, and we'll see example, this is like, let us say it's vacuum tubes. Now you go to transistor, right? It does the same thing, but it's a completely different technology, if you will. So when this new technology catches on, right, this drops. Like vacuum tubes, I mean, there are some very niche products, but very expensive. Because everybody has switched to the new technology, this becomes very expensive. So, but there are recommendations if you find yourself in a stage 4, you want to become luxury item. Like if you look at mechanical watches, right, when the quartz movement came, quartz movement had better accuracy than mechanical watches. And if you look at the Swiss watch companies, right, the 80s, they really went down, right, because quartz movement caught on. And the only way they have survived is now to go into like a luxury type thing. Okay, so that is, for our devices, we is really not in there, but that's one thought, right? So if you look at S-curve, right, and this was, there was a camera, and actually I did use it. It was called one of the early digital cameras. It was Sony Mavica. Okay, when it first came out, it was $13,000. Okay, yeah, 1300. It only did a 60 KB image because it was storing this memory of this is 1.4 megabytes. It took 6 to 7 seconds. Okay, and digital is now competing with film. Film, roughly a 4x6 is 30 million megapixels. So now, why, this is 97. Why did digital even succeed or even survive? It met an unmet need, which is sharing. Okay? If you look at that time, 95 is when Netscape came up and we had the World Wide Web. People wanted to take pictures and share it immediately with others. Right? Polaroid, you could see your picture instantly, but I couldn't send it to somebody sitting far away. That was also the time when, you know, the World Wide Web is coming, web design, putting pictures on your web, etc. They had a need for that. So the point I am trying to make is, if you just measure your main parameter of value as saying picture quality or picture density, right? Your initial product, if you compete on that, you're going to fail. Because digital, even today, perhaps doesn't meet the quality of that film, if you will. Like a 30 megapixel, you get a Hasselblad or some of those huge cameras, if you will, right? But they identified, and this is also the change in the environment and the technology going on, they identified this need of sharing, which film just couldn't meet. Right? I needed to get digital images also for website development. So that started, and as far as digital cameras go, we are here. You cannot, I mean, if you sort of go with a business plan saying, I I have idea for less than $500 digital camera. How many people are going to buy that? Why is it going down? Because the phone camera has gotten so good, right? So there's a market for high end, right? But those are like few $1,000 type camera, digital cameras, but these $200 below cameras is almost gone. Okay. So now this question about which should I innovate? Okay. So this is just this is some market modeling type stuff we did. So the global market is increasing, right? It starts here 3%, and this is your current product. Okay. Like you mentioned, over time, typically, whatever you're selling, the price is going down, And now, do I do incremental versus next generation innovation? Incremental means you're on the same S-curve. And next generation means you're on a different S-curve. The underlying technology is different. Incremental innovation, right? The value is, the total like revenue, etc., is going to be less than next generation. But it is going to start earlier than this, and it will also need less money to develop that. Incremental innovation may be a 510K product, not like clinical trial PMA type. Okay? So this is, reward is more, but associated there is risk. Risk and money is more here than that, right? So yeah, that is a question for every this one. If you look at Toyota Prius, Toyota, right? They came up with the hybrid way before anybody did, right? The Prius is, I don't know, at least 10 years or more than that. If you look at internal combustion engine, the future is uncertain, but a lot of companies are betting on electric, right? But Toyota doesn't have electric car, right? They are actually betting on hydrogen fuel. So when you look at the next generation, what the new S-curve will be, that is not always very clear. Okay? You really have to find what is the benefit of this new thing. And the second thing you have to look at is sometimes the new technology has a penalty associated with it. For example, electric car, the penalty associated with it is Tesla, you can drive from Boston to California, but refueling is at least a 1 hour endeavor, right? It takes time to refuel. So the challenge with it is, does this new technology that you have add value that overcomes sometimes there might be associated issues or penalties with it? Okay. All right. So one of the things of this S-curve thing is, way back, if you look at music per volume, right? Way back you had one song on an LP, then a whole album, and then of course the Walkman came along, mobile, then the CD player came along, and then of course today that's what music is. Okay. And Clay Christensen at Harvard Business School, he wrote this book called Innovator's Dilemma, right? And as you see, these are all different S-curves, right? One of the biggest things you see is that the Walkman was Sony. This is Philips. This is Apple. So the new S-curves are always, typically, not every time, but 9 out of 10 is done by somebody else, not the person who is dominating the current S-curve. And that is what he calls the innovator's dilemma. Okay? And the reason for that is, when you're in this early stage, because of R&D cost, etc., you're negative, right? You haven't made money. It's essentially you start making money in the stage 2, and your peak money is in stage 3. When you're making so much money here, right, are you going to sort of, I think what they say is, are you going to eat your young? Are you going to eat the money made of this to switch over to there? Right? That takes, Intel did that, Andy Grove, that was a world-renowned case study from memory to processor chips, if you will, but there are not that many examples. But now it is understood, and that is something you'll always have to look at in product development. And another thing, as far as innovators are concerned, there is this thing called pioneers, right? If you look at settling the US, right? Pioneers, this is a picture of Tesla, who looked at, and this is Netscape, right? And then the pioneers first went out, and then after that you had the settlers come in, right? This is Edison, this is Internet Explorer, and in Shark Tank, one of the guys made this comment, and as entrepreneurs keep that in mind. Okay, if you're early, right? I mean, the AC current was the winning technology done by Tesla, but it's sometimes the second person actually makes the money. The digital music, Apple made all the money, but they weren't the people who invented it, if you will. Okay, so that's just like a note of caution, if you will. And the other thing to want you to keep in mind is you may have a grand vision, okay, but you have to take things in baby steps. If you look at Google today, right, Google is in everything. They're changing computers, they're changing phones, they're changing everything, right? But when you start, if you try to do a huge change, sometimes, and you sort of, when they came out and you sort of say, you know what, we're going to do search, but when you don't use your computers that you have, we're just going to replace everything. Sometimes the change is so big that people are not going to adopt it. You want to approach it in steps, if you will. Right? They came up with search, then the browser, now there is OS systems, okay? And this is, again, a terminology called 15-minute advantage, which is you want to be ahead, but not too ahead. For example, they have seen, right, like monkeys using tools like rocks to break nuts and things like that. But if you give a monkey a cell phone, what is it going to do? You still use it as a rock, right? So if you come up with like too advanced, even as humans, we may not be ready to adopt that. Okay? So the takeaway here is think big, but you should have what is called multi-generation plan. Okay? Break up your idea into smaller pieces, and some of the initial pieces you want to, like the camera, and you want to coexist with the current environment. Let's say you have an idea for a game, right? You want to have the game working on smartphones, not with its own Nintendo thing, because everybody is used to phones. I'm not going to go back to the thing of carrying two different devices, if you will. Okay? So have multi-generation, coexist with the current environment, and then have the plan to change. Okay. So since you are all physicians, this is one actually we worked at Covidien. So way back when, there was something called surgical stripping, but it is used to treat varicose veins, right? You have vein swelling, you surgically pull that vein out and you get that, right? Initial stages, it looks cosmetic, but what happens is your veins have one-way valves, and as they sort of deteriorate, your blood will start pooling at the bottom of the leg and you'll get ulcers over there. So you do have to treat that. Okay? And the standard of care was surgical stripping until there was a company that Covidien bought called Venus. And what they came up with, so way back when the technology was surgical stripping, and they came up with an electrocatheter, right? You insert the catheter in the vein, you heat it up, and the vein collapses on itself, and you keep moving it down. Okay? So this is the new technology, and that is used today. Now, and it's definitely the standard of care today, but why did it succeed? What is the metric or the main parameter of value for this device? if you really looked at it in terms of what the main parameter of value on this was, if you measured it in terms of OR time, or the time it takes to do, physicians could do more of these in a 8-hour day than this. The main parameter of value was essentially monetary. We may try to think of pain and grotesque and all those kinds of things, but when you look at trying to understand main parameter of value, you really have to understand what is the motivation. If this, although it is less painful, took more time than this, it is not going to be successful. Because if I can do 6 of this and 4 of that, I'm going to stick with this. But if I can do 6 of this and 8 of that, yeah, because I get paid per procedure. Okay? So understanding this main parameter of value many times is not just the first thing that comes to mind is saying, oh, it is less painful, things like that. Okay? Because, yeah, it's less painful, but after 3 days, the pain is not really there. There is another model in terms of user needs called the Kano model, and what it does is on the x-axis, if somebody wants, let's say, memory on the smartphone, okay? On the x-axis, we measure how much memory we are providing. Less memory, more memory, okay? And based on how much memory you are providing, you look and see how happy the customer is, okay? And there was again a gentleman called Kano who basically said all the wants that customers have are not created equal. Okay? The first kind of want is things that they are not aware of. They are called delighters. Like if you don't provide it, they are not unhappy, but once you provide it, they get happy. When I had to travel a lot to California for business, and when JetBlue came with live TV, I'm always flying JetBlue because I had to fly Sunday and I can watch NFL, right? So live TV on the plane was like, wow, that's driving me to buy JetBlue tickets, right? The second kind of want is called performance. These are the things that when you make a decision, these are the things you choose, right? When you buy a car, you're looking at towing capacity, fuel efficiency, safety, all those kinds of things. These are the things that people use to make decisions. But there is this other kind of thing, need, which are called basic, that if you don't provide it, they are unhappy. But if you provide it, it's not necessarily that they are happy. Okay? And we look at an example. This is like the Olympus endoscope, right? When you're buying these devices, people look at image quality, maneuverability, how well it is to insert. So this is what people use to make selection. They have some novel features. This is what they sell, that hey, this is why we are better. This was I think they had like 85% of the US market, but they recently had a recall. Okay, that's because of expected need that they couldn't clean this thing properly. So basic needs are needs that you don't, when you talk to customers, they don't express those. But for medical device like biocompatibility, safety, sterility, those are given, right? Otherwise, you're not a medical device. But if you fail one of those things, it will have a huge negative impact on that. So there was that one slide which said, you get one killer app, right? The second thing you have to do is understand what are called these basic needs or must-be needs. Okay? Also understand that customers are not, like when you say, why would you, which airline would you purchase airline ticket, you talk about the price of it, on time, all those things, but we are not talking about airline safety or other things, right? Those are basic and assumed. Okay? But if you're entering into a new space, if you haven't done glucose monitoring before, and I have an idea to work in this glucose monitoring space, I better understand what those basic needs are, because if my product is lacking that, it will not sell. However, on the basic needs, you just want to meet the minimum standard. You cannot say I am more sterile, I have higher sterility than competition. I am more biocompatible, right? But if I don't have those basic needs, I am not going to sell. So the second kind of features you have to have in your product is these basic needs. Okay? And the third is this performance needs. So when you hear from customers what they want, right? They want many things, and you just take that whole laundry list. The worst thing you can sort of do is say, I heard these 20 things from my customer, and I'm going to put it all in my device. The time and money of your product is going to be so high that maybe your product cost is not going to let it sell, right? So you want to prioritize and say, what is it I'm going to include? And this is a technique that you use to do that. And the other one is similar thoughts on that, right? If you're measuring importance of a feature to the customer versus how satisfied they are, anything below, like on a 1 to 10 scale, right? Below 5 is not worth really addressing those things. They are not important enough to the customer. If you ignore some of that, it's okay. Things that they are important but they are satisfied, you don't want to compete in that place. You just want to be equal to what competition is. Where you want to compete are important things that customers are dissatisfied with. This is opportunity for you. Okay? So when you look at your complete product, right, this is the opportunity for you. Important things with poor satisfaction. Then comes the question of, iPhone has done this very classic, is like how much memory should the lowest iPhone have? Until now, it was 16 gigabytes, right? And just now they increased it to 32. So when you say this is an opportunity, the question becomes memory, right? People love memory. More the better. But then, of course, there is costs associated with that. And for you, the question is, how much of it should I provide? So if you look at a thing of glucose monitor, right? These are some of these features of a glucose monitor. It's like test time. Does it take 5 seconds or 12 seconds? Blood, how much blood? Half a microliter or 1 microliter? Does it have an app, right? Does it transmit data to Bluetooth? And the cost. If you provide these kinds of and tell customers to choose, what do you think is going to happen? You're going to choose the best of everything, right? Customers are very smart that way. And you said, you know what, I did a survey, I gave them the choices, and they chose this thing. As what have you done? You have defined a product that you cannot make, right? So to address this issue, there is another technique called conjoint analysis. Okay? In conjoint analysis is you give them choices of feasible products, and you say, you know what, pick this or that. Okay? If most customers pick this, that means that they like an app functionality more than the blood quantity. They are willing, if more pick this, that means they are willing to tolerate a larger pricks like lancet size, but they want app over this. That guides your product development, right? So you do conjoint analysis to find out, when you say which feature you want to choose between the levels of the feature, that is done using conjoint analysis. But the point of this is you cannot design this unified ultimate product if you don't go in with that approach, because you'll never get there. Okay? So to be successful, right, this is sort of summarizing everything, you need this one killer app. Okay? This is that main parameter of value on the S-curve. Right? This is from doing this KJ image and finding an underserved need, right, that is not met today. You have to have that. Okay? You have to have these must-be features. These are things that customers assume that if you're selling, cell phones, it should last one day for of use, right? They're not going to perhaps talk about that. They're going to talk about touchscreen and camera and all those kinds of things, right? You have to identify that and just meet the minimum. You don't need to be better than. As long as everybody is used to charging every day, you just meet the battery life of one day. Third thing is preferred features. You'll get a laundry list of features. You got to prioritize that. That is where this prioritization is that max diff. That's actually an analytical survey technique. And then the second thing is how much. That is the conjoint, which is again an analytical survey technique. You have to do that because your product can't be everything. Okay? And to sort of finish up, right, the greatest sort of innovator in our lifetime, there is a quote from him, is that innovation is not about saying yes and just putting more and more and more into the thing. It is about saying no to 1,000 things. And when you have to say no, you have to say yes to the right things, right? That is what this is about. Right? So if you have ideas, you're working on products, first find out this one. What is that one differentiator that it meets and it's a meets a non-existing feature, like an underserved user need, right? That's what this KJ technique is all about. You have to have that. If it is something you are not familiar with, you have to have these must-be features, and then we have that other features, prioritization, and how much. That will sort of define a winning product. We know the destination, right? We defined what is a good product. Now, of course, it is how do we get there fastest, right? Once you have defined it, you're like, okay, when can we start getting revenue, right? That's all the game is about. So before we begin, okay, product development is the green. Okay, when you have an idea of a product, if you say, I have the idea, but this little piece, like the auto injector, we have to invent something. That is here. That is not product development. Okay, that is technology development. Okay, technology development is iterative, it's unpredictable. You cannot say, invent something in 3 years, right? You cannot give a timeline on invention, whereas on product development, if all the existing pieces of technology are ready to put it together, we can make this more predictable, and business plans have timelines and revenue forecasts and things like that. You might slip a quarter here or there, but you're not going to slip grotesquely. Usually when products don't launch on time or there is a big mess up, it is because they have put technology somewhere here saying, oh, we have 9 out of 10 pieces there, but we just have to invent this one thing. Wireless charging of the phone, like people will walk in and it will automatically charge. That's the only piece missing, but everything else we have. That one piece will kill your product. Okay? So when you have an idea of product, it has to, when you start here, it has to be all the pieces there. Okay? And academia is more on this side, but they are moving towards that. Okay? And the reason is the valuation is much more there. Right? If you develop a concept and show everything is working, there is more and more money over there. Within your sort of environment, there are a couple of places which are moving down that path from the red to the green. Right? Way back when it was a little more separation, right? Academia, research lab just did research, and then engineering, product development did that, but nowadays the marriage between the two is more. And from the academic standpoint, you want to move further to the right, because the more mature your product vision is, the higher the valuation. Okay. So, product development, there are two things. One is this is FDA controlled, regulatory design control, right. The FDA requires certain things by the time you get a product done, right. But just doing, they are concerned about safety and efficacy. So, this only focuses on, FDA is concerned about safety and efficacy. They are not really concerned whether your product made money or not, right. But if we did not make money, we would not be in business anymore, right. So, in a product development process, you have this, you have to do this by law, but you also have a lot of business and commercialization deliverables. Where should we manufacture? How should we distribute the product, right? Should we sell it with the control solution or without the control solution? Those are just business decisions, right. But that also, when you launch a product, those considerations have to be made. Okay. So, if you look at product development, there is a tension between three big groups, if you will. The market, right, this is what the customer wants. The engineering sort of says, can we do that? Can we meet what the customer wants? Okay. But you also have manufacturing saying, can you design something, but can we make it profitably, right. So, the ideal product sits at the intersection of all this. If you do not have one of these three saying that is going to be hard to do, I would say that you have not pushed the boundaries in your product development. The idea is like, the question is it going to be that drastic in the marketplace? If it is, all of this is easy, 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 your product is a me too product. Then the question becomes, you are competing on price. Is your manufacturing going to be able to do it that much cheaper, right? You are in stage 3 of the S curve. So, when you look at it before you start beginning to develop it, right, in the early stages, you want to have these three, and somebody saying that is a challenge, okay, because you want to make these trade-offs. Then you know that you have pushed the boundaries of the vision or something for the marketplace. So, that is one, and on top of that, anybody doing project management here? Okay. The project management, right, as soon as you have product development, the green, we have cost and time and schedule, right. So, you have this constraint, quality is not negotiable, right, we are a medical device, this is a given. So, then you have how much is it going to cost and what is the thing. So, this is what product development in the industry is all about. Okay. First is the definition, and then these are the constraints, and we work within that, and how we do. So, this is to get quality, this is the FDA waterfall, right. They have user need, design input, there is a black box just as design process input, and then outcomes medical device, right. It looks very simple, but if you just say do design process, right. The challenge within a company is that you do not want different teams to do this differently, because then you are relying on the capability of, let us say, the lead engineer, right. If I ran into a battery problem, I will think about it. If I have not, I may launch a Samsung 7, right. So, you want there to be consistency in there, and the way they do that is we use what is called a stage gate method. Okay. Usually companies have 5 stages, and this is stage 1, stage 1, or it is called concept. These are the key deliverables of that. Okay. And typically, I would say in this room you are either in stage 1 or we will look at stage 2, but that is where you are going to be in. But by the time you say I understand stage 1, you should understand the market and the needs, like what are the features that are going to be in the product. Okay. You should absolutely have that, and that will drive, and when we say develop concept, it is like a idea of the pieces that will go inside your product. And then business plan obviously is incremental or next generation, so you'll know how much money to be made and things like that. So that is stage 1. Then we get into what is called development stage, and the needs have to be translated in, like customers will say, I want more memory. How much memory should I provide, right? So you need specs, and by the end of development stage, you should be able to make one of the product. All the working parts, usually it's like a large breadboard. It's not going to be like, if you're doing a cell phone, it's not going to be like a very small cell phone, but it will have all the working pieces in there. Okay, that is like the alpha prototype. At that stage, you do a project plan, and everything else beyond that becomes very predictable. Then the next stage is, because we're a medical device, we call it verification and validation. Verification, you're making sort of 100 pieces of it. You got prototype manufacturing, you can make a few of those, if you will. By validation, you should be able to mass produce. I'm able to do 1,000. I have nailed down all the manufacturing, where it is going to be manufactured, what are the supplier base, the whole gamut, if you will, right? For Model 3 Tesla, that huge lithium factory is being built. If he's going to double the capacity of lithium batteries in the world, he has to source so much lithium. The question, and that's something obviously they have addressed, is there that much lithium available? Or do we have to make deals with mining companies to sort of say, this is our 3-year vision, you start producing, right? He's not getting into mining of lithium. Okay? And then the last one is launch. Usually at the end of this validation stage is you start selling. Okay? And launch is essentially about 6 to 9 months after you start selling it. You're doing post-market surveillance, right? You're looking at, by now you have production history, you're looking at quality, you're looking, are you meeting cost? The big thing is a launch, right? Initially you may say we are going to launch in the US, but then we have to look at Europe. Is the regulatory paperwork on track to have this global sales, if you will? And medical device, depending on the scale of things, it might take 3 years, like a significant device, not just a small tweak, if you will, right? So you have to celebrate. The people in the team have been working very hard for 3 years. That is the sort of, they live and die with that, so you absolutely have to do that. So this stage gate approach is also useful. For example, when you go and try to get funding, let's say you have an idea of a product and you say, you know what, this is going to make $50 million, give me 10 in 3 years, right? Now, that is an ask, right? But if you break it up into small sections, you sort of say, to concept, usually the money increases, right? You sort of say, this is my vision of the product to make, do some market research, etc. I just need to validate my assumptions. I need $500,000. Okay? Somebody is willing to pay you that much, and you say, I'll come back and answer these questions for you for that kind of money. And if at that point we'll reevaluate, if it still has that 50 million, this one, give me money to make prototype. So if you ask your money in tranches following this one, you're more likely, to the person you're asking, he's more convinced that you have been methodical rather than just saying, give me $10 million 3 years later. It's hard to get money that way, very hard, right? I mean, even in businesses, right? Because what happens is we start projects and suddenly we find out that here we cannot manufacture at cost. We need it to be less than $5, but we are coming in at $8. So if you ask money in these tranches, a project gets killed at any of these sort of gates, if you will. So think of this as, okay, two things. One is here, we said that you have to do design control. That's FDA required, right? But in addition to that, you also have to look at meet the commercial requirements. Okay, and think of this as like, this is a great slide image that Scheller put together, like Panama Canal, right? This is like the locks, right? So the ship comes here, then it floods that. Once it equilibrates, then you go to the next stage. Okay? So using this stage gate approach, what happens is that one function, right? Product development has marketing, engineering, manufacturing, regulatory, many different functions. You don't have 5 out of the 6 functions already and sort of say, you know what, engineering is still has some issue that they need to resolve, right? You don't go from one gate to the other until all the deliverables are met. And even if you do it with the known risk, right? If you're sort of saying engineering is only, 3 months away, all right, we'll assume that risk and then go to the next stage. So that prevents, because oftentimes, especially in the startup world, right, they have a business plan. They say, oh, we should 12 months from start of sale, let's hire the marketing person. So he's on board, he's talking to the customers, but the product prototype is not ready, alpha is not ready yet. Then we say, you know what, we'll catch up. We'll skip that and go to the next one. And usually if you take that kind of approach, it just doesn't work. Okay? It is done using a process we'll call the RACI. The requirements of this process, right, a stage gate process, one is it should be scalable. Depending on am I doing a new curve or am I just making a tweak on a product, right? We can't have the same diligence or activities for both. Right? So we have to be scalable, it should tie into project management, and the third thing we need is oversight. When you get into product development, right, it's a multi-function, cross-functional team there. You have to have all these pieces like regulatory, clinical, quality, all these pieces in your team. If you're missing one of these functions, right, you sort of say, you know what, we haven't, with manufacturing we are going to outsource, we don't have a representative here. You will make design choices or set specifications that are too tight to make profitably. And because it's medical device, you have to, if you change specifications after the regulatory paperwork is filed, you have to wait and refile the spec changes. It's hugely time consuming and expensive to do. So you have to have, these are, my sympathies are always with the manufacturing because A, they're at the tail end of the process. If everybody has taken a little more time than they should, the last person holding the baton is manufacturing. And they're like, why are these guys taking time, right? Everybody is looking at who is at the end and saying they are slowing it down. And many times they are struggling is because decisions have been made early in the design phase. So I would say from your how you can influence that triangle of manufacturing, engineering, and marketing, right, is really have a good understanding of the use case. And when you set the user need, let's say they say memory or the force required to activate the device, okay, or the like it's an auto lancet type thing. What is the force required? You should have make sure that when it's translated into product specs, you are looking at maybe children as young as 8. The force they can apply is different than you just take an average 30-year-old male, right? They can apply more force. Or you should also, on the other side, look at elderly people who have diabetes, but there is early onset of arthritis, etc. So the specs that are set, make sure that it addresses all the user base that you are going to sell to. So that is definitely the translation of needs to product specs. That is where you can have a huge influence. Okay, and it's almost the product development. You know, once you get into concept and development, many times there are outfits like Zymedica, Bridgemedica, who will do the actual verification, validation, etc. for you. But when you set specifications, make sure that it is manufacturable at cost, because sometimes what might happen is that you can make it, but you have to now use, let's say, a laser or some higher technology which is more expensive to make. And now you thought you would get a market share of $50 million, but because of the pricing, now only $20 million is your market size. So you have to make those considerations early on in the thing. So include manufacturing in your thing. So the way they do that is we use something called the RACI. Okay, the R is, if you look at the sheet, R is like responsible, A is accountable, C is consulted, and I is informed. Okay, and the way it works is, let's say for the concept stage, right? We said there are deliverables you should do, and these are just examples of that. Like, what's the market opportunity analysis? What's the business case? Is there any IP? Right? You don't want to go later down and find out that, oh, somebody already has patented some idea of yours, right? You want to include that early in the thing. So these are just a subset of a huge laundry list. Usually this laundry list is a couple of hundred sort of things. Think of this RACI as a, like, if you go to a Chinese restaurant, you have a lot of things to choose from, but you're not going to eat everything, right? So for every project, it's not like you have to do everything. Okay? So the team will select which of these things we have to do. For example, if I'm just doing incremental innovation of my glucose monitor, I don't need a huge IP landscape review because I already have the IP. So I would say I'm not going to do that. Okay? But some of the other things, if no clinical test, IRB or something is not required, I'm not going to do that activity. But this is essentially the laundry list of activities. And then these are the stages, and draft, D means draft, right? F means sort of final version. Okay? We just use a color coding like that. S means it is final but signed. If the document has to go into design control, the FDA requires, like, depending on the document, certain functions have to sign, like a quality department, regulatory, clinical, they have to sign. So S is also a final document that is signed, and U means it's updated. So the business case is updated at every stage. Like if you say $50 million over here, is it still 50? Or is it's a 3-year plan? Maybe some other S-curve has started, and now your market is smaller. So you got to revalidate that. Okay? So that is what it works. And then this is the RACI part, which is, these are the different functions. Every activity has only one owner. The A is sort of like the owner, right? If I'm the project manager, I'm looking at market opportunity analysis, I'm not going to ask the whole team, hey, where is it, what is going on, right? I'm just going to go to the marketing person and say, you are supposed to do this by this day. Where is it? Okay. But A is accountable. That doesn't mean the A is the person having to do all the work. The R's are the people who help. There can be multiple R's, but R's are the people who help the A complete the task. Okay. C is essentially consult. Sometimes if I make a change on my design, right, I might have to consult with legal, right? That's consult, as you can see, is basically you do consult before you make a final design change. So we use this RACI to sort of get things done. If you're in concept stage, you got to accomplish this, right? And the expectation is not that you're going to do everything over here. So for your project, let's say you're in concept or development, right? We'll just go with concept. This is what you have to do to basically be at a stage where you can go and say, you know what, I have a business plan, I can go and talk about funding and things like that, right? But you're not going to be the expert in all of this, right? So if you have to do these sort of broad deliverables, what is your team that is going to help you do this? Like when Cheryl and I talked, she said, hey, let's do the seminar. She's the slide expert. Like all these beautiful graphics is her. So yes, I could have done it, but it's not going to look pretty. Don't take it as, okay, the days of one man, right? Edison doing, burning 1,000 different elements. That is not how product development works. It's too complex now. There are like software, hardware, especially medical device, regulatory, clinical. You do need input from all these functions. So for your particular project, even if you look at concept stage, right, who is going to determine that based on what you're doing, does it require a clinical trial or not? Because the business plan, valuation, and timelines will change, right? Is it novel enough, or your regulatory person could tell you whether you need 510K or does it have to be 510K with clinical or PMA or whatever it is, right? You shouldn't be making that determination. Depending on your concept or idea, right? If you have to even do this, what team members or functions will you need, right? And who is going to be the accountable, right? User needs, it could be you're doing it, or that's where there are a lot of consultants who help do that for you, right? So that is advantages of using the system and how you would do that, if you will. Okay, couple of other things. Okay, this is if you're doing project management or the project management, how the people use RACI is first you have a function, right? And the function lists all the things that they are accountable for, right? So these are the things that I'm in engineering. I am responsible for product spec and drawings. So these are the things I have to do in concept stage. Okay? But for product specification, I need to know user needs, right? So then I would say, what is the input I need to do specification? I need to know user need. So these are the inputs that are required to do my deliverable. Okay? So this would be, let's say, user need. And the reason to do it this way is to make sure that when marketing has their flip chart, they have a deliverable called user need. Because if they are not doing user need, I can't put it as an input on my sheet, right? And that is how all these deliverables get linked up to make Gantt chart. Gantt chart is essentially list of activities versus timeline, right? I think they came up with that when they tried to do man on the moon effort, if you will. And then in between the input and the output, right, you can't say, I'm going to take 6 months to do that, right? If you just say 6 months and then I check with you 2 weeks before and you're like, oh, something came up and I'm now 3 months late. So what you do is you basically go from here to here and break it up into 2-week long tasks so that we can monitor whether the project is behind or ahead. Usually behind. Behind or on time, right? That's usually. So these are the tasks, and usually you take from here to here, break it up into 2-week long chunks, and that's how project plans, etc., get done. And the list of deliverables and these inputs essentially come from that RACI. Yes, having this detail behind it will give me confidence that yes, this is reasonable, the time estimates. If you suddenly say, I'm going to do a clinical in 3 months, I'm like, okay, I know it takes roughly 2 years, so the delay product launch is going to be 2 years from what you're saying, right? So that's what this helps. If you have done the analysis and the homework, right, it gives confidence to the person essentially who is funding the project that yes, you're going to, I have a detailed plan, I'm going to hit the timelines, etc. And oversight, this is the project team, right? You have the program management, core team, etc. But this is the team that works on. Usually at a company you'll have functional, like I need a mechanical engineer, chemical engineer, software engineer. you'll grab people, a quality person, etc. You'll grab them on your team. And then there is this executive board, which essentially, even if we are not in a company, right, they essentially look at funding for the next stage. Okay? But in between that, you do need to have this, what is called a stage exit review. We looked at all the deliverables on the RACI, and we said these are the ones that should be completed in the concept stage. Okay? This is usually like a 2 to 4 hour type review, and you have to have that deep dive review which sort of says these are the deliverables that the team has to do, right? But this is like an independent review. Does the user needs, have they really talked to enough customers? So some medical device, FDA says start with user need. There will be a document saying user need. But when you come to the review, it's like, okay, who are we trying to sell to? Okay, we are trying to sell to cancer and orthopedics. How many of doctors have we talked to? That kind of due diligence and deep dive is what happens at a stage exit review. Okay? It makes sure that when you say a deliverable is complete, it is really meets like an independent, I'm not saying audit because audit is a formal word, but an independent stamp of approval. Because if you don't, what is this? Right? So they were going to change Theranos. People know the story. Elizabeth Holmes, she was a Stanford student, then started this company. They were going to make blood test, take much smaller blood and essentially bring down the cost of it. And this was like definitely next generation S-curve and all that. A lot of money got invested. Last year its valuation was so much, but the challenge with this was the science. People, they didn't have perhaps that scientific, I mean, if you looked at this board, they had Henry Kissinger and a very lot of high level political power there, but they didn't have this scientific advisory who looked at, is the technology really doing what it's supposed to?